Welcome to This Week in Radiology. This week we're covering 10 notable papers spanning advanced magnetic resonance, imaging innovations, cutting-edge neuroimaging and neurovascular interventions, and practical diagnostic frameworks in breast, cardiac, and molecular imaging. Let's dive in. We begin with a series of major developments in thoracic and abdominal magnetic resonance imaging that focus on speed, efficiency, and clinical utility. In a prospective study, Palmisano and colleagues evaluated a single-breath whole-lung magnetic resonance imaging protocol enhanced by artificial intelligence-powered compressed sensing. Comparing this rapid 17-second scan against state-of-the-art photon-counting detector-computed tomography in 97 patients, the researchers found that magnetic resonance imaging achieved an overall sensitivity of 83% for solid nodules. Crucially, for clinically relevant nodules measuring 4 mm or larger, the sensitivity rose to 98%, showing excellent size agreement with computed tomography. While the magnetic resonance scan failed to detect small calcified nodules under 4 mm, which made up about half of the missed cases, it demonstrated perfect agreement with computed tomography in high-risk lung RADS categories. This suggests that a single-breath hold artificial intelligence accelerated sequence could serve as a highly effective radiation-free screening alternative. In a complementary effort to optimize magnetic resonance workflow, a study in the Journal of Magnetic Resonance Imaging by Fullerton and co-workers introduced a high-throughput clinical suite architecture utilizing an artificial intelligence-prescribed, free-breathing chemical shift-encoded sequence to quantify liver fat. Evaluating 24 healthy volunteers across 72 total exams, the team achieved diagnostic image quality in every scan, with total room times averaging less than 4.5 minutes. This automated rapid protocol allowed for an extraordinary throughput of 16 exams per hour while maintaining highly repeatable liver proton density fat fraction measurements. To help clinical practices successfully execute these kinds of high-performance abdominal protocols, a comprehensive educational review in radiographics by Dana and colleagues provides essential physics insights for liver magnetic resonance protocol optimization. The authors detail how to balance the contrast-to-noise ratio, spatial resolution, and signal-to-noise ratio, offering step-by-step guidance on selecting pulse sequences, managing fat suppression, and implementing advanced motion suppression and acceleration techniques to prevent diagnostic errors like missed focal lesions. Moving to neuroradiology, several new publications offer tools to improve surgical planning and predict patient outcomes. Writing in the AJNR American Journal of Neuroradiology, Constanzo and colleagues introduced the C-LIPS grading system, a novel method for predicting cavernous sinus invasion in pituitary neuroendocrine tumors. By bisecting the carotid artery along anatomical planes across 5 distinct compartments, lateral, inferior, posterior, superior, and clinoidal, the C-LIPS system was tested on 255 patients. It demonstrated an overall sensitivity of 91%, a specificity of 98%, and an overall accuracy of nearly 98%, far outperforming the traditional NOSP classification, which only achieved moderate inter-observer agreement. Meanwhile, in another prospective cohort study, she and colleagues utilized 4-dimensional flow magnetic resonance imaging to investigate how the anatomical completeness of the circle of Willis influences long-term hemodynamic adaptation after bypass surgery in 45 patients with Moyamoya disease. The researchers discovered that patients with an incomplete circle of Willis experienced a significant decrease in bridge artery flow and velocity, alongside increased vascular resistance over time, whereas these parameters remained stable in patients with partial completeness. This highlights the critical role of preoperative vessel anatomy in predicting long-term surgical success. Further examining neurovascular anatomy, the D-Motive study published in the AJNR American Journal of Neuroradiology explored whether simple computed tomography angiography metrics could predict outcomes in 51 patients undergoing mechanical thrombectomy for distal M2 occlusions. Fernandez Espigares and colleagues found that a high sagittal M2 tortuosity index of 1.19 or greater was strongly associated with poor outcomes, including a lower rate of complete recanalization, 39% compared to 70% in less tortuous vessels, and a dramatic reduction in 90-day functional independence. This simple, readily accessible metric could prove invaluable for patient selection, given that distal medium vessel thrombectomy has not yet shown clear superiority over medical therapy alone. To round out these neuroimaging advancements, a comprehensive review in radiographics by Pavlushkov and co-authors highlights the expanding role of advanced neuroimaging in planning, guiding, and monitoring targeted, minimally invasive neurosurgical interventions. The authors discuss the critical imaging parameters required for high-intensity focused ultrasound, laser interstitial thermal therapy, and deep brain stimulation, illustrating a profound paradigm shift from open surgery to highly precise, circuit-based therapies. Our final theme covers essential clinical frameworks and guidance across multiple imaging subspecialties. In the Journal of Magnetic Resonance Imaging, Raimondi and colleagues published a joint scientific statement from the Association for European Pediatric and Congenital Cardiology and the International Society for Magnetic Resonance in Medicine, establishing a standardized reporting framework for cardiac magnetic resonance examinations in pediatric patients and adults with congenital heart disease. This statement aims to harmonize reporting practices and reduce variability across international centers. In breast imaging, Lowell and colleagues presented a practical radiologic dermatologic atlas in radiographics to help breast radiologists evaluate skin abnormalities of the breast, chest wall, and axilla. Because many dermatologic conditions present with non-specific or absent imaging findings, this primer integrates clinical morphology, physical exam characteristics, and imaging features to help radiologists confidently determine when a skin punch biopsy is indicated. Finally, in the field of molecular imaging, a review by Myers in the AJR American Journal of Roentgenology offers clinical guidance on optimizing and personalizing the selection of prostate-specific membrane antigen, or PSMA, radiopharmaceuticals, helping clinicians tailor agent selection to individual patient scenarios to maximize diagnostic yield. If you only have time for one paper this week, make it the prospective study on single breath hold lung magnetic resonance imaging with artificial intelligence-powered compressed sensing by Palmisano and colleagues in European Radiology. This work provides compelling evidence that a rapid 17-second radiation-free magnetic resonance sequence can achieve near-perfect sensitivity for clinically relevant solid lung nodules, offering a viable and highly practical alternative to computed tomography for lung cancer screening. Here are the key takeaways from this week in radiology. First, a single breath hold, artificial intelligence accelerated lung magnetic resonance imaging sequence can detect solid lung nodules 4 mm or larger with 98% sensitivity, representing a major step toward radiation-free screening. Second, the newly developed CLIPS grading system offers an exceptionally accurate 98% precise method for predicting cavernous sinus compartment invasion in pituitary tumors, outperforming traditional NOSP grading. Third, high sagittal M2 vessel tortuosity on computed tomography angiography is a strong predictor of poor recanalization and functional outcomes in distal M2 thrombectomies, serving as a valuable tool for patient selection. Fourth, preoperative assessment of the circle of Willis using 4-dimensional flow magnetic resonance imaging can predict long-term hemodynamic adaptation and bypass success in patients with Moyamoya disease. And finally, rapid artificial intelligence prescribed free-breathing chemical shift encoded magnetic resonance protocols can safely reduce room time to under 5 minutes while maintaining excellent repeatability for liver fat quantification. That's your roundup for this week in radiology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary for clinical decisions. Always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.